Angiography machine. An angiography machine is a specialized medical imaging device used to perform angiography procedures. It consists of a table, X-ray machine, and a computer. The X-ray machine emits a beam of X-rays which are passed through the patient's body and detected by a special device on the other side of the body. During an angiography procedure, a contrast agent is injected into the patient's blood vessels to make them visible on the X-ray images. The X-ray machine then takes a series of images as the contrast agent flows through the blood vessels, providing a detailed view of the blood vessels and any blockages or abnormalities. There are different types of angiography machines, such as digital subtraction angiography, DSA, machines, computed tomography, CT, angiography machines, and magnetic resonance, MR, angiography machines. Each type of machine has its own advantages and disadvantages, depending on the type of procedure being performed and the patient's individual needs. Angiography machines require specialized training and expertise to operate safely and effectively. They are typically found in hospitals, clinics, and other medical facilities that specialize in diagnostic imaging and interventional procedures. Angiography. Angiography is a medical imaging technique used to visualize blood vessels and organs in the body. The procedure involves injecting a contrast agent, usually iodine-based, into the blood vessels and then taking X-ray images. During an angiography procedure, a small incision is made in the skin and a catheter, a thin, flexible tube, is inserted into a blood vessel and guided to the area of interest, such as the heart, brain, or legs. The contrast agent is then injected through the catheter and X-ray images are taken as the contrast agent flows through the blood vessels. The resulting images allow the radiologist to evaluate the condition of the blood vessels and diagnose any abnormalities or diseases, such as blockages, aneurysms, or arteriovenous malformations. Angiography can also be used to guide interventions, such as stent placement or embolization of blood vessels. There are different types of angiography procedures, including coronary angiography, used to evaluate the blood vessels in the heart; cerebral angiography, used to evaluate the blood vessels in the brain; pulmonary angiography, used to evaluate the blood vessels in the lungs; renal angiography, used to evaluate the blood vessels in the kidneys; peripheral angiography, used to evaluate the blood vessels in the legs or arms. Angiography is a minimally invasive procedure that carries some risks, such as bleeding, infection, and allergic reaction to the contrast agent. Your doctor will carefully evaluate your individual situation and determine whether angiography is an appropriate diagnostic or therapeutic tool for you. Angioplasty. Angioplasty is a medical procedure used to treat narrowed or blocked blood vessels, usually in the coronary arteries of the heart. The procedure involves inserting a catheter with a small balloon at the end into the blocked artery and inflating the balloon to widen the narrowed area and improve blood flow. During an angioplasty procedure, a small incision is made in the skin and a catheter is inserted into a blood vessel and guided to the blocked area in the artery. A small balloon at the end of the catheter is inflated to compress the plaque against the artery wall and widen the lumen of the artery, allowing blood to flow more freely. In some cases, a stent, a small mesh tube, may be placed in the artery to keep it open and prevent it from collapsing or becoming blocked again. The stent is placed over the balloon and is expanded along with the balloon, then the balloon is deflated and removed, leaving the stent in place. Angioplasty is a minimally invasive procedure that typically takes a few hours to complete. It can be done on an outpatient basis or with an overnight hospital stay. The procedure carries some risks, such as bleeding, infection, and allergic reaction to the contrast agent. Your doctor will carefully evaluate your individual situation and determine whether angioplasty is an appropriate treatment option for you.